My name is Katrina White, and I serve as the Health Education Program Manager and the Public Information Officer for Rockingham County Department of Health and Human Services. Well, Rockingham County is a quiet and fairly large rural community here, and it's part of the Triad region of North Carolina. It is nestled at the foothills of the Blue Ridge Mountains, and we're only 1 hour from the mountains and 3 from the beaches. And we take pride in our lakes, our rivers, our walking trails, and everything good to do with outdoors. Rockingham County Division of Public Health serves as a multidisciplinary safety net provider for citizens here in Rockingham County. We have services such as pharmacy, dental clinic, adult health, child health, vital records, WIC and nutrition, environmental health, family care coordination, communicable disease monitoring, and my department is the health education, where we serve as surveyors, if you will, or monitors of the county's health in general. Not only did COVID-19 shed a light, but it was a glaring light on the medical mistrust here in Rockingham County. I saw what I like to call the Great Divide, and there were segments of the population that received the vaccination, and there were segments of the population that chose not to receive the vaccination, and it was based on medical mistrust. And we understand that, and we, historically, we know why they felt that way. Sure, there's medical mistrust in all populations, but there's a prevalence in the Black and brown communities, and we need to address this because it impacts it because of the mistrust. It's having a negative impact in our community's health. With mistrust, we're reluctant to receive the necessary care that we need for ourselves and our families, and it's just something we need to come together as a community to talk about.
My name is Merrill Holloway. I'm the Executive Director of NC 100 and a Program Manager for MDC Rural Forward. We could probably talk for years if we talk about how systemic discrimination, racial strife has impacted Rockingham County. There is a history obviously in our communities and in our country of discrimination and racial injustice. And there's also a lack of discipline of folks being able to connect the interest that creates positions. And so we have a lot of folks that rely on their own lived experience. And when you rely on your lived experience, sometimes you don't hear or aren't able to get yourself to connect to folks as human beings. And so that shows, it manifests itself in who leads, who you see up front, the images that you see, the values that people hold dear, and it creates barriers that can impact systems that are supposed to be equitable and have access for everybody.
Your Voice, Your Health project is a grassroots initiative to look at health equity here in Rockingham County. And what we're doing with Your Voice, Your Health is we're looking a little broader into, or digging down a little deeper, as you will, into medical mistrust and health inequities. And we want to use a community or citizen approach. So we're working with and bringing citizens together for deep discussions about medical mistrust. We're looking at the history of it. We're addressing it from that standpoint as to where we stand today and how we can move forward. What we want to do is collectively come together and create strategies that's going to be sustainable and be feasible as we move forward future generations.
My name is Vanessa Stubbs, and I am the Health Equity Coordinator at the Rockingham County Division of Public Health. There are times that we have to educate people so that they understand, both internally and externally, that the issue of health disparity and health inequality is everybody's challenge. It's everybody's challenge, because whether or not a person is being impacted personally, within their own families, whether or not they're being impacted socioeconomically, or whether or not it's just simply an issue of social justice. The issue of health disparities should be on everybody's radar as a problem and an issue that we need to tackle and that we need to mitigate.
The things that I feel are so great about the social drivers here in Rockingham County is that the fact that we're all collectively looking at the social drivers or the social determinants of health and seeing how one thing ties into the other. It's just not about your physical health, your mental health, your dental health, but you got to look at your environment, where you live, where you work, where you go to worship, where you go to school, and just the things in your environment that supports health or is a barrier to health.
Ideally, I would like to see a time where a person such as myself in the role of health equity coordinator to exist. In other words, in a world where the disparate outcomes are not something that we're constantly trying to battle on any given day. And so, ideally, I would like to see that, but until such time that utopia exists, I would like to see this county continue to do what it's doing. In other words, with deliberation and with intentionality, that it devotes the full measure of its time, its personnel, and its resources to making sure that each and every individual throughout Rockingham County can achieve their best possible health outcomes. And so that certainly is our goal, and that's what we're striving for. And all I can say is stay tuned and watch us work.